We at CHS aim to fully integrate every segment of the prescription event. The prescription event consists of the prescribers, payers, pharmacists, and patients. Let's take a look at the typical prescription process. A doctor will give patients a prescription according to their diagnosis. The patient then takes the prescription to the pharmacy. The pharmacy then has to process the prescription to the payer, or its agent, or PBM, and if everything is approved, the pharmacy fills a prescription and the patient receives their treatment. However, the prescriber is not in the loop and therefore does not know if the patient is actually getting the prescribed medication. The prescriber only assumes since there is no callback from the pharmacy. The above process gets complicated if the prescribed medication requires a prior authorization. In this scenario, the payer or PBM has to notify the pharmacy that the prescribed drug is not covered. The pharmacy then has to call, fax, or email the doctor to notify him or her that the prescription was denied, after which the doctor has to perform the prior authorization process for that payer or PBM. If the prior authorization is finally approved, the payer or PBM will notify the doctor, who then must notify the patient or the pharmacy. It is after all these extra work that the patient can get the prescribed medication. You can see that this becomes a very lengthy process, which could take days or even weeks. This process gets even more frustrating with multiple payers or PBMs, each with a slightly different procedure. Our patent-pending HealthCareSolutions360 design was designed as an intelligent platform to optimize the prescription event. It resolves many of the challenges and inefficiencies of the modern-day prescription event for all stakeholders. With HCS360, prescribers will now be able to access formularies, allowing prescribers to immediately know which prescriptions will require prior authorization for the patient's insurance. If no prior authorization is needed, doctors can send prescriptions straight to the pharmacy with a patient's diagnosis. This way, pharmacists will be able to dispense the patient's medication and be able to counsel them according to their diagnosis, a feature current electronic prescribing systems lack. HCS360 offers constant communication between pharmacies, prescribers, and payers, providing a higher quality of healthcare more efficiently. If prior authorization is needed, doctors can send prescriptions directly to the payers. The payers can then decide if they will cover the prescribed drug or which pharmacy they want to send the prescription to, allowing the patient to receive their treatment in a much shorter time. You can see that the HCS360 platform offers a fully integrated and much more efficient healthcare delivery system. So what are some other features of HCS360? Doctors will be able to access the patient's refill schedule, seeing both the date and time of each refill. This allows prescribers to more accurately verify patient compliance. Pharmacists can use HCS360 to instantly send refill requests, to which doctors can also instantly authorize. The refill authorization windows include remark boxes that encourage communication between doctors and pharmacists. HCS360 offers the ability to send oncology prescriptions or Part B medications on the same platform. No other electronic prescribing systems or healthcare platforms allow the prescription of both Medicare Part B and Part D drugs. Let's look at an example of how HCS360 works in the complex environment of oncology prescription processing. The oncology prescription process requires that multiple medications be processed as one regimen. Also, most payers require prior authorization for oncology regimens. The prescriber enters the patient's required prior authorization information, such as diagnosis, intent to treatment, stage of cancer, etc. The prescriber then selects the drugs for treatment along with any instructions. The prescription window allows doctors to search for drugs by name, HCPCS code, or J-code. Here, the doctor has entered the following drugs for treatment. The prescriber can send this directly to the payer for prior authorization or send the prescription directly to the pharmacy if prior authorization is not needed. Here, the prescriber has decided to send the prescription to Golden Rule Insurance for prior authorization. In this case, Tom Greco Pharmacy has not received notification of the new oncology prescription. This is because this prescription has not been authorized yet. Golden Rule Insurance has been notified of this new oncology prescription. Golden Rule Insurance has access to the patient's diagnosis, treatment, and prescriber information. Now, Golden Rule Insurance can approve or deny the prescription. They can also choose which pharmacy to send it to. In this case, they are going with Basil Xavier Pharmacy instead of Tom Greco. Basil Xavier now has a new notification of an oncology prescription. Basil Xavier Pharmacy now has all the patient's diagnosis and treatment information. The prescriber can instantly see when his oncology prescription has been authorized. The prescriber also knows when the next refill will be. The prescriber will also be able to see that the payer has chosen to send the prescription to Basil Xavier instead of Tom Greco Pharmacy. This is just one example of how Healthcare Solutions 360 will provide a more efficient healthcare system. Healthcare Solutions 360 is truly innovative in that it allows the doctors to access benefit determination information prior to sending the prescription to the pharmacy. Our patent-pending technology moves the prescribing decision to the beginning of the prescription event, unlike the current process of having the decision toward the end of the prescription event. There are too many features to cover in this short introduction to Cooperative Health Solutions' industry-first HCS360 platform. Other features include the ability to manage multiple payers, the ability to elect preferred pharmacy networks, a single platform to perform prior approvals of both Part B and Part D medications, formulary designs and care pathways, the ability to make referrals, instant messaging, e-consults, and much, much more. Don't be stuck to technologies that abide by the same old rules in prescription events. Let CHS show you how its patent-pending HCS360 platform can transform the prescription event and make doctors, pharmacists, payers, and patients more efficient and cost-effective.